This is Medical Spa MD. Hello everyone and welcome to the show where we help cosmetic physicians reclaim control of their medical practices and lifestyle. Even if you're clueless about running a business and you're already working 60-hour weeks, Medical Spa MD is brought to you by medicalspamd.com, a worldwide community of physicians practicing cosmetic medicine. Hello, Jeff.
Hello, Andy. How are you doing?
I'm very, very well, Jeff. What's new, Jeff? The Medical Fusion Conference, what's the latest news there?
It is. I talked to Greg a little while ago, and it looks like we've got additional people signing up, and including a couple of Medical Spa MD members. So I'm pretty excited about that, and look forward to seeing everybody down in Las Vegas on November 5th through 7th. I think it's going to be an excellent time, and certainly a lot of fun, as well as whatever benefits education-wise that we're going to all have.
Well, coming up a little bit later, we have an interview with Dr. Elliot Justin, don't we, coming up? But we'll talk about him in a little while. You've got a question for me, haven't you, Jeff?
I did, because we were having a conversation just before the show, and I realized that you're helping already some physicians with social media.
I am.
Getting their word out and stuff. And I just wanted you to kind of mention that, Andy, and drop kind of a note on what it is that you're both doing, and how the physicians are kind of both reacting and what results they might be seeing.
Yeah, I am working with a cosmetic physician, actually, over here in the UK. He's done some quite interesting things, actually. I think he started off with video. He was doing a lot of video. And he had a very sort of fairly straightforward strategy. He was just putting a lot of informational videos on YouTube.
Now, is he doing this to kind of actually provide content to his own site and become, kind of a friendly face, or was he just doing this for SEO purposes originally?
No, he was doing it. He was doing it generally as a friendly face. He just wanted to put more information out to clients. But the interesting thing that he's doing is actually aiming at different audiences. So he's doing some videos for like potential clients, but he's doing some audio podcasts for who could potentially be argued his competition. So for other sort of, cosmetic physicians or aesthetic physicians. So he's got quite an interesting strategy.
Well, does he do training and stuff as well?
He does. He does his main sort of like plastic surgery stuff, but he also trains. He does sort of cosmetic courses and things like that. So he's got a different audience there as well.
Sure.
But his videos got him quite famous. They were very, very well looked at. And when I say videos, he's got videos sort of a friendly talking face about how Botox works, or what you might expect if you're having this done or if you're having that done, all the way through to actual surgery, which is a very interesting approach. I remember the first time I saw one of those, and I had to. I avoided jam sandwiches for about a week, I seem to remember. But nevertheless, it was very interesting. That's rich coming from someone that wanted to be a doctor as well, actually, isn't it?
Well, it is.
But it's fascinating videos. And I remember one story he told me that I think it was before he'd put the actual surgical videos out, he'd already got a very good following on, I think, one of the, when I say one, like his channel of YouTube videos. And he was visited by, I think, a couple from the Middle East. And the lady was so enthralled that she'd actually met him that she wanted a photograph taken with him. So that's a sort of effect that you can get just by sort of putting some informational videos out on YouTube. But yes, he's also got a number of audio podcasts that he's pushing out, and I've actually lost count to how many audio podcasts he's got. I'm not talking episodes here; I'm talking about actually podcast series. So he does focus it at various different audiences, and I'm not sure what feedback he's getting. I presume it's quite good. I think maybe you'd need to speak to him and directly.
How long has he been doing that?
He's been doing it for the audio podcasts for, I think, well over a year now. And I think the video ones he was doing before he actually hooked up with me. I think he'd been doing the video ones probably for at least 6 months before me and him started working together.
Well, we'll have to get him on the show, and he can talk exactly about what he's doing and why he's done it, and actually why he's continued to do it. But he must be getting results from it.
I think he is. Yeah, I actually think that social media. Is social media the right term? Yeah, it probably is the right term. It is potentially a very good thing for physicians to get into. I don't know what it's like over in the US, Jeff. I don't know what sort of how physicians normally.
To be honest, I see a lot of attempts at it that are. I give anybody credit for making the attempt because actually taking action is the first step. But often, a clinic will have a Facebook page or they might have a Twitter feed or some other kind of thing, but they're not really providing any value. What they basically do is go on there and paste, we're having a special or come in and see us Tuesday or some other kinds of things. There's really kind of no sophistication, what I would call sophistication around what it is that they're attempting to do. And you will often see that they have maybe, 20 followers or on Facebook likes or 100 or, maybe a little bit more. Now, to be honest, I'm not a huge Facebook user.
No.
I do have two young women in my household, and they tend to be on Facebook a lot more than me.
Same here.
But we do use, I think we have a Facebook page, and we do have some resources kind of pushing that or we're looking to develop that. I mean, Facebook now has 500 million users.
I've lost count. It's huge. It's bigger than some countries, isn't it? Well, than lots of countries.
I think it's the fourth largest. If it was a country, it'd be the fourth largest in the world now or something.
Yeah, probably the third largest by now.
And certainly it's only a matter of time until they hit, they've got 500 million now. They will at some point. It is growing in Europe. You guys do they have a Facebook UK or is it all the same Facebook?
Do you know? I don't know. I think it's just facebook.com. I think it's the same one. Because when I've linked up with people across the pond on Facebook. I'm sure I have, unless I'm getting mixed up with LinkedIn. I think I have on Facebook.
Yeah, LinkedIn is another one. It's not nearly as big, but it's focused more on businesses.
I don't know about across the pond, but LinkedIn has seen a bit of a resurgence in popularity over here in the UK recently. Yeah,
I would say that's the same here. It is a very good way to kind of network through to individuals and get an introduction or to see how connections are kind of working. Much more business oriented than Facebook is by any stretch of the imagination. Yeah. And I'm on LinkedIn much more than I am Facebook. But Facebook for consumers is becoming almost a go-to destination now, where patients or potential patients will go on and mention a treatment or physician to their friends to kind of get feedback. I've seen that. I've seen that myself, and anecdotally a number of times. The physicians have been looking. I've been a little bit challenged on how to kind of adapt to this new kind of form of marketing. I'm a proponent of certainly online marketing and think that the yellow pages and the kind of old school marketing is absolute. If it's not on its way out the door, it has certainly been shown its hat.
Yeah, quite possibly. Just going back to the whole sort of the potential for using social media as a way of gaining trust and showing people what you can do. I really do think that showing people or giving patients reassurance, which is something that my guy over here has been doing a lot, telling patients what will happen and what sort of results they can expect, and also testimonials. I mean, there must be so many people searching. The whole cosmetic field must be so well searched.
It is. There is a tremendous amount of competition around that. My own feeling is that it's not necessarily showing somebody what the treatment is going to be like. What you're really doing, if you're successful at this, is you're attaching a face and a personality and giving some warmth to somebody who is searching for this. There's a tremendous physicians that are successful in the consultation room, and in effect, although physicians very rarely like to admit it, selling treatments. I mean, we are talking about retail cosmetic medicine, are those that can generate an amount of or a level of trust in their patients that the patient says, this is the person who I trust, and when they say this is how this should be done and why it should be done and this is the best treatment for me, that I'm going to believe them. I mean, trust is really kind of where that gets to. And so when I see, and I do this because one of the services that our select partner Front Desk SEO provides is Facebook modification and upkeep and special offers and that kind of stuff. So I am very kind of well aware of how this is going on through that. But where physicians often will, if they're just doing promotions, will not really generate any leads from that, and they might have 50 or 60 people that have just kind of attached themselves to this page or kind of liked it. If it's done really well, it can be both a powerful motivator into the marketplace, as well as very effective for the physician, both their reputation and their business. Getting the word out. And because there's no payment, I mean, if you actually do this really well, the return on investment from a business sense is very, very high. I mean, it is not like the Yellow Pages where you're paying, $1,500 or $3,000 a month. It is literally just a little bit of time and expertise, or the hiring of a more sophisticated outside service, which is not the Yellow Pages is super expensive for what it is that you get, and educating yourself a little bit about how to go about these types of things will go a long way to kind of helping you grow your practice, and not only that, but give your patients some sense of community. This is something that is just terrible as a business practice for cosmetic practices, is this complete lack of kind of follow up and patient care. Meaning how many times you touch a patient, and I mean touch by contact them or provide them additional value after they've had a treatment. I mean, if you are lucky, the most sophisticated clinics, not the most sophisticated, but clinics that are thought of as being sophisticated, will send out a newsletter. But that's just kind of one point of contact, and it's generic to everybody. And I have seen some clinics that are really generating tremendous ROI because it's very easy to do, that just provide this kind of value to their existing clientele, and they allow their existing clientele, they in effect arm them to go kind of spread the word, and both their reputation benefits as well as their business bottom line.
Definitely. You hit the nail on the head there, actually, when you said trust. Another one is authenticity.
I think almost everything can be led back to trust, right? If you come across as fake, people will eventually, oftentimes they'll see through that immediately, or that, you're trying to hype up something or sell something. Medical Fusion Conference. I just put that in there as that subliminal.
Now, I am, just as a perfect segue, I am looking at the website of Dr. Elliot Justin, who we're going to be or you are going to be interviewing, aren't you? Tell us a little bit about him.
Well, Dr. Justin is very interesting. He's actually going to be, and I kind of laugh because he actually is going to be one of the speakers at the Medical Fusion Conference, but he has a number of outside businesses. He is a emergency room physician. He has graduated from both Harvard, and then he went to the Boston University School of Medicine. And he has a very well respected physician, but he has started a couple of businesses. One of which is Swift MD, and that's you can see that if you want to at swiftmd.com, and that is a teleservice for physicians to provide healthcare advice and medical advice to individuals and groups, so businesses, those types of things, and it's a interesting service. In effect, you can call up and either talk to a physician, or the physician will call you back and give you an honest opinion. So I think that I'm going to be talking, and I'll let Dr. Justin kind of denote more about that. But really interesting interview. I was actually very interested that, because this is something a little bit of a novel service, and I was interested in both how Dr. Justin got this started, and where they are right now, and where they're planning on going, and how they see this marketplace developing. So sort of really interesting interview.
Yeah. Okay. Well, let's have a listen.
So, Elliot, let me ask you, start off. You have a couple of businesses here. You've got SwiftMD, you've got Pegasus Emergency Group. You consider yourself an entrepreneurial physician, but what do you consider an entrepreneurial physician to be?
Well, in my specialty, emergency medicine, an entrepreneurial physician is a physician who